The teeth that have been selected for sealants must have deep pits and fissures and be sufficiently erupted so that a dry field can be maintained. Blow a jet of air from the syringe onto a mirror to be sure there is no moisture in the lines. Thoroughly clean the teeth with pumice and water to remove plaque and debris from the occlusal surface and rinse thoroughly with water. For this patient, cotton rolls will be placed to control moisture contamination. Apply a generous amount of etchant to all enamel surfaces that will be sealed, extending slightly beyond the anticipated margin of the sealant. Allow the etch to remain on the tooth for a minimum of 15 seconds, but no longer than 60 seconds. Thoroughly rinse teeth with the air-water syringe to remove etchant. Remove the rinse water with suction. Do not allow the patient's saliva to contact the etched surfaces. The dry etched surfaces should appear as a matte frosty white. If they do not, repeat the etching steps. Slowly apply the sealant into the pits and fissures. Do not let sealant flow beyond the etched surfaces. Stirring the sealant with the syringe tip or brush during or after the placement will help eliminate any possible bubbles and increase the flow into the pit and fissures. Hold the tip of the light as closely as possible to the sealant without actually touching the sealant. A 20-second exposure is needed for each surface. Carefully inspect the sealant for complete coverage and voids. Check the interproximal areas using dental floss to make certain there is no sealant material in the contact area. Wipe the sealant with a cotton applicator to remove the thin, sticky film on the surface. Check occlusion using the articulating paper and adjust if required. Document the procedure in the patient's chart.